Welcome to our Insight series on organizational well-being. Our question for this week is, what additional behavioral targets can your wellness program address? Number 29. In answering the question, what additional behavioral targets can your wellness program address, we need to recognize the choice of behavioral targets, in addition to the big 10 that we've talked about already, is usually shaped by your program's goals, and again, prioritized goals are going to be much easier to work with and to implement, and the needs of your population. Now, some of the things that you could in fact add to what we've talked about as the Big 10 are a flu avoidance related to COVID or related to a pandemic threat, other tobacco use besides smoking tobacco, but smokeless and chewing tobacco and other forms, lack of preventive screening, so the issue of how much screening is being done and how do you find out what you need in terms of preventive screening, excessive chronic alcohol consumption, what that looks like, and particularly the evidence around the maximum amount of alcohol that we should imbibe as a regular part of life. The binge alcohol consumption issues, the high saturated fat diets and the problems with them, low dietary fiber intake problem, inadequate fruit and vegetable consumption, excessive caffeine consumption, high-risk sexual practices, high-risk recreational practices, over-the-counter medication abuse, undetected depression, poor nutrition habits, carelessness or injury prevention, lack of seatbelt use, excessive sun exposure, lack of supportive relationships, illegal drug use, inappropriate health care use, insufficient sleep or rest, overly passive healthcare consumerism, unsafe home practices, eating disorders, elevated blood sugar, pre-hypertension, pre-diabetes, obsessive dieting, prescription drug abuse, and distracted driving. Now, wherever you see an asterisk, it means that those items are and produce short-term economic return. So once you start working on those specific topics or behaviors, they will generate a faster response to any needed healthcare conservation or the lowering of rates of growth in healthcare costs. So in summary, there are a large number of additional behavioral targets besides the Wellness Big 10 that an employer wellness program can address. The choice of which of these behavioral targets is addressed is often influenced by the goals of the wellness program, the needs of the employees, the costs and difficulty of implementation, and their likely effectiveness. Now, for more information on this topic, try putting the following search strings into your web browser: employee wellness topics and targets, various types of wellness targets, risk factors for wellness issues in working populations, prevention tips for employees. Next week, we will address the question, why is the workplace a great place to do wellness programming? For more information, feel free to visit our website at www.chapmaninstitute.com.